Good evening, everyone. I am Dr. Lakshmi Nagendra, and on behalf of Endocrine Society of India, I take pleasure in welcoming you all to today's session. So today's ESI Facebook Live session is on obesity, myths and facts. We hope to be debunking a lot of myths about obesity and also answer some of the questions that you might have on obesity today. So for this session, I'm extremely honored to have four eminent panelists with us. We have Professor P.K. Jabbar, sir, Professor and Head, Department of Endocrinology at Government Medical College, Trivandrum. Welcome to you, sir. We have with us Dr. Radhika Jindal, ma'am, Associate Professor, Department of Endocrinology, Vardhaman Mahavir Medical College and Safdarjung Hospital, New Delhi. A warm welcome to you, ma'am. We have with us Dr. Saqib Ahmed Khan, Consultant Endocrinologist at New Life Endocrine Center, Lucknow. Welcome, Dr. Saqib. And we also have with us Dr. Shyam Sundar, Consultant Endocrinologist at SS Sparsh Hospital, Bangalore. Welcome, sir. So today we are excited because we have chosen the topic of myths and facts in obesity. And as I mentioned earlier, we'll also be happy to answer any questions that you might have, anything that you might have read on diet or, about exercises, the right kind of diet, is intermittent fasting helpful, are keto diets helpful? So any sort of questions that you can have, please put them on the comment box and we'll be answering them for you. So to start off, Jabbar sir, this question is for you. So one of the biggest myths about obesity is that obesity is caused due to a lack of physical activity, or what it is seen as the person not being active, or due to an unhealthy lifestyle. So is it entirely true? What is your take on this, sir?
Thank you, Dr. Lakshmi, for a first beautiful question. First of all, I should thank ESI and the team for the wonderful platform provided for us. So Dr. Lakshmi's question is an issue of obesity. Obesity is becoming a real pandemic now. Obesity or Jasti Vazan. Nowadays, the data or studies from various states, including Kerala, showed a very high incidence of 28. It's around 30%. All other states also having more or less same picture. Our neighboring states like Tamil Nadu, Andhra Pradesh, kidhar bhi jao, udhar you can see the classical, the increased chance. Okay, I'll make it very simple. Increased chance for developing more weight, and that can lead on to a lot of problems. The issue is it because of physical inactivity, or is it because of taking a lot of food? Now, if you see the picture, any metro city, you go to any place, there are a lot of eating counters are there. You'll get a lot of beautiful foodstuffs also there, like pizza, kisa, kusa, something like that. And people are taking a lot of food like that. That can produce increased vitamin. But whatever said and done, physical activity is also a factor which can lead on to increasing weight. Another small family. Suppose your family member is having obesity. You are born in that family, so you can get obesity. So what I want to tell you that, my dear friends, obesity has got a lot of factors. Maybe no exercise, maybe increased food intake, and there are familial problems also. In addition to that, I will make a very simple point. Any patient with obesity, जास्ती वजन आएगा तो वो टाइम में please see your doctor. Don't take it granted. Don't think that it's a very simple problem. I will reduce my food. I will increase my exercise. ऐसा मत करने का. Always you should talk to your doctor. If you are working in Delhi, you go to another place. If you go to Kerala, you go to another place, and get a consent or clearance from your doctor saying that, okay, this is only because of physical inactivity, or taking lot of high calorie foodstuffs. What I want to tell you that there are other causes also for overweight, like see hormone problems. You have lot of hormone problems which can lead to increase in weight. That's the reason take a consent or evaluation from your doctor for achieving a good diagnosis. Needless to say that nowadays certain drugs also can produce increasing weight. There are lot of drugs, maybe psychiatric. Man ka mushkil aayega to all time you are taking some medicine. All these medicines can produce increased weight gain. Even though we have good medical setup now, these are the contributive factors. To conclude, what I want to tell you that there are lot of reasons for increasing weight. All these things should be discussed with your doctor, your family doctor or consultant, and take a right decision to improve your health. That's all from me for the time being. Over to Dr. Lakshmi.
Thank you, sir. So, as sir said, the obesity can be multifactorial, and there could also be secondary causes of obesity, for example, hormonal disorders. And we should not be dismissing obesity as, this is just due to physical inactivity or, eating unhealthy food. It should always be evaluated by an endocrinologist or a physician. And it should, once you get the correct diagnosis, the bottom line here is that many causes of obesity can be treatable. In fact, most causes of obesity can be treatable, and it is very much possible to get back to a normal body weight with the correct advice from your doctor. So my next question is to you, Radhika ma'am. So another misconception is that only people with, high body mass index have complications of obesity, and most people perceive that people who are thin do not have any complications of obesity or the risk factors for any cardiovascular diseases. So what is your take on this, ma'am? Is it only people with high body mass index or weight on the higher side who have complications of obesity?
Thank you, Dr. Lakshmi, for this question.
Sorry, ma'am. I think there's a network.
Normally, obesity is defined at.
Radhika, ma'am, I think your voice is not clear. It's breaking. No, ma'am. Still not clear. Okay. Why don't we go on to the next question, and we'll get back to Radhika, ma'am. So, Dr. Saqib, my next question is to you. Most people say that weight reduction is difficult, but maintaining the weight reduction is easy. So many patients come and say that weight कम करना is बहुत मुश्किल होता है, पर कम करे तो वो मेंटेन करना बहुत आसान होता है. तो आपका इसके बारे में क्या कहना है?
At the outset, I would thank Endocrine Society of India for this wonderful opportunity and every one of you. So it is not a risk factor anymore. When we talk about obesity, it itself is a disease. And it is a disease where even the new nomenclature like adiposity based chronic disorder has been given to it. It means that it would lead to metabolic and mechanical complication. And like any other chronic disease where the patient might have remission or these kind of condition where the patient might not require for a certain period of time those efforts in the form of diet and lifestyle modification or pharmacotherapy or metabolic surgeries or bariatric surgeries, but it might recur because, as it has already been explained, it is a multifactorial disease. Our efforts as well as our genetic predisposition, they both decides it. And the environmental factors like the availability of food and all those things, which they would be present over there. And so it would be a task when we talk about the attaining meaningful weight loss. And even maintenance of that is even more difficult, because the body's behavior changes with the passage of time. The resting energy expenditure decreases. It tries to resist the further weight loss. So it would be more difficult with the passage of time to not regain those weight. And for that, after having a good calorie reduction, we have seen from some very good studies that if we do that, after that, for the maintenance of that weight loss, it would be very important to have sufficient exercise and continuation of those efforts.
Thank you, Dr. Sakib. So efforts needed for both weight reduction and weight loss, and I think it should become a part of our lifestyle, the healthy eating habits and healthy exercising habits, which can lead to weight loss and maintenance of weight loss as well. So we have Radhika ma'am back with us. Ma'am, as I was just asking you, do you think patients with a normal body weight can also have some complications of obesity or, risk factors for cardiovascular diseases?
Yes. So obesity is different in terms of the mass index. Calculated program have a normal weight, which is BMI of 5, 3 Indian population. 20 but
ma'am, I think your voice is
this
breaking
body mass
again.
Index does not take into account
Hello?
I can hear.
Yeah. It's better now, ma'am. Yeah. Ma'am, are you there?
Index not take a body fat, which is responsible for the adverse cardiovascular risk associated with obesity. It is possible that a person having a normal weight or a normal BMI may have increase in the body fat. Is having a normal weight, but at the same time, a higher fat mass is prone to the complications of obesity. Over.
Thank you, ma'am. So my next question is for Dr. Shamsundar. So many people with a higher body mass index, like, somebody who's around 100 kgs, feels that a lot of weight needs to be reduced to have any benefits, to have any health benefits. So I had once a patient asking me that, I am now 100 kgs. In fact, he was 106 kgs, and he said that, he was also diabetic. So I told him that the remission of diabetes is even possible with weight loss. Then he said that, should I lose some 30, 40 kgs? Is it even possible to lose so much weight? So at what percentage of weight reduction do we see any health benefits?
Okay. At the first, I would like to thank the Endocrine Society of India for providing this opportunity. And thank you, Dr. Lakshmi, for the question. So to answer this question, most studies have shown that the benefits of weight loss are linear. It is proportional to the amount of weight loss. And if we want to take a particular cutoff, it would be at least 5%. So even at 5% weight loss, there is a significant, at least 30 to 50% reduction in the new incidence of diabetes. And also there is a reduction in the blood pressure by at least 3 to 5 millimeters of 3 to 5 millimeters mercury of blood pressure reduction is also seen. And also there is improvement in your cholesterol parameters in the lipid profile with at least just 5%. So a person who's like, just as you mentioned, who's 106 kgs, even if he's able to lose 5 kgs over a span of time, and it need not be acute, like it's not just defined like 1 month or 2 months or 3 months. It is the slow and sustained reduction of weight which is much more beneficial, And even at the percentages of 5% of weight loss, there is definitely benefits are seen. Over to you.
Thank you, sir. So now we are going to discuss the various myths and facts regarding the various modalities of obesity treatment. So before we start off at the outset, Jabbar sir, I would request you to give us a brief overview of what are the modalities available to treat obesity.
Good question, Dr. Lakshmi. I think say obesity treatment birth mushkili. Okay, please remember, very difficult. But there are treatments. Okay, effective treatments are available. You can start with the simple things. Soda, at least few steps. Dr. Shamsundar was discussing the weight reduction to percentage and all. Good, but it's not that easy. So whatever possible moment is really good. Recently we got a paper from our society, our international society. Even 5 minutes or 10 minutes simple exercise is good. So one method is exercise. Number two, your food, very important. I remember when I was a DM student, that time, no fast food business. Now everywhere, food with a lot of oil. In colloquially, you can call it as oily food. Oily food is very heavy, my dear friends. And any food for that matter, even chapati, if you are taking 1 dozen of chapati, that's also dangerous. And take good quality foodstuffs, like say good fruits, vegetables, condiments, something like that. So first is minimal exercise at least. Yes, there are guidelines for doing exercise, the duration of exercise, type of exercise, but in general, whatever be the type of exercise, little movement and dietary modification. Number three, it's very important. Your behavior also should change. Very simple, I will tell you. I have a like in a bad habit. I'll go to my kitchen and I'll take something. And I'll go to my mommy and I'll take 1 piece of chicken piece. And I think I'm not taking anything. Even ladies are making a comment like that. Doctor, कुछ नहीं है, खाना नहीं है, पीना नहीं है, my वजन थोड़ा जास्ती है, क्या करने का? ऐसा नहीं है, my madam. See, you are taking something. Maybe little chips, In Kerala, banana chips are very commonly produced. Banana chips, any chips. That contains lot of oil, lot of calorie. So, if you are taking one chicken leg or few chips, very heavy. And but the patient think, no, I'm not taking anything. Not correct, my dear friends. So, number one, physical activity. Number two, this thing. And behavioral therapy. Behavioral therapy, very simple. Just keep a seat in your dining table. I will take, from today onwards, I will take food in that chair only. Very simple method. So probably your food will come down. The third method, if you are especially South Indians, you are using, hand only to take your food. Dr. Lakshmi knows that. Instead of that, take a spoon, take rice with a spoon. That will reduce. Both comes kar sakte hai na? Definitely it showed like that. So these are the three methods. Number 4 method is your medicines. Medicines, good. I remember lot of medicines came in various time. Now, good molecules are coming up with good efficacy. My dear friends, always think that medicine treatment is the last method. The first method is whatever we discussed just now, 3 methods. And last method is surgery. Surgery, good, but you should choose the physician first. Physician should give clearance for surgery, because one fine day morning going to theater, unlike cinema theater, right? Going to theater and doing surgery, and you'll end up with problems. Happen many times. So what I want to tell you that the treatment modality or one treatment surgery is available, but before going for surgery, go to an endocrinology friend or physician friend, get evaluated. Then you can go for surgery. So I'm concluding with 4 or 5 points. Number one, exercise करने का, थोड़ा खाना कमती करने का, थोड़ा modification of your behavior should be there, and medicines are there, and lastly, probably least important in certain aspects, but still you can use it. So these are the various treatment modalities for your obesity. Over to Dr. Lakshmi.
Thank you, sir. So as sir said, we do have a lot of modalities for treatment for obesity, and we have efficacious methods of treatment as well. But the cornerstone of treatment in obesity will always be your lifestyle modification, diet, and exercise. And even when you're taking medicines, or even when you go, say, for a bariatric surgery, your healthy diet and exercise should follow. And it's not like, you can start eating on anything or not exercise at all when you've taken medicine. So my next question is to you, Radhika ma'am. So there are a lot of misconceptions about diet. So some people say that for quick weight loss, you should be following certain fat diets, or people advocate keto diets, or high fat diets, some low fat diets. So what is your take on the correct type of diet that should be advised for obesity? Do we have Dr. Radhika? So we'll come back to ma'am. My next question is to Dr. Sakib. So most people believe that medicine should not be taken for weight loss because obesity is due to unhealthy eating habits and lack of exercises, and taking medicines has a lot of side effects for losing weight. And also, once you stop on these medicines, you are going to regain the weight no matter what. So what would you say about this?
So thanks for this question. So it is always a myth when we talk about that diet and lifestyle modification, which is the cornerstone of the management of this chronic disorder, would be sufficient enough without any other help. So if we want to equate it with diabetes, like diabetes has, when we talk about the type 2 diabetes, which is the most common reason of hypoglycemia, the diet and lifestyle modification is the cornerstone, but it would not be enough because it is a progressive disease, because it is a chronic disease. Likewise, obesity would be requiring diet and lifestyle modification, behavior alteration, seeking the other reasons. But along with that, according to the degree, according to the problem, according to the comorbidity, if the patient cannot walk, if the patient has already developed osteoarthritis, if the patient is already not having sufficient sleep, if the patient has already developed obstructive sleep apnea, it would be very difficult to ask those patients to have sufficient walk or sufficient exercise. Then there is a place of pharmacotherapy or even bariatric surgery when the patient is a suitable candidate for. So it would be required in those patients where it is needed, and in them it can definitely do a wonderful thing. It is not that diet and lifestyle modification would only be the thing which would be solving the problem of this chronic disorder.
Thank you, Dr. Sapi. So my next question is to you, Dr. Shamsundar. Many people are very curious to know about intermittent fasting. It's the new in thing new these days. Everybody is talking about it on social media and everywhere, and many people have a lot of questions. So what is intermittent fasting? What's the principle behind intermittent fasting? And does intermittent fasting really help for weight loss?
Okay. So this is a very interesting and upcoming area. So intermittent fasting is an umbrella term which covers different methods. So there is one method where you do alternate day fasting, and there is the 5:2 method where you eat your normal diet for 5 days a week, and for the 2 days you restrict your calorie intake to around 400 to 500 calories per day. And the third one is time restricted eating, where in over a period of 24 hours you eat for only say around 6 to 8 hours, and the rest of the time, say 16 to 18 hours, you are not consuming any caloric intake. So these are the three forms of intermittent fastings, and there are other forms as well. So now the one which is gaining popularity is the time restricted eating, where you eat your regular caloric intake for the certain amount of time. And definitely the mechanism of action of these intermittent fasting, if we see, so as we all know, say for after 4 to 6 hours of our food intake, so whatever the energy is driven by the intestinal, the digestion and the absorption of the glucose. So after 6 hours, it is the glucose storage, which glucose which is stored in the liver, which is giving us the constant energy supply. So say after 8 to 10 hours of your last food intake, so the glucose stores from the liver is lost. Then comes the fat, which is stored, and then the fat is burned to produce energy and to maintain your glucose levels. So this is the principle, like where you fast for more than 8 to 10 hours of after your last caloric intake, your fat is getting lysed, and that is producing the energy. So this is how the fat loss is what is contributing to the weight loss and metabolic benefits which could be seen with this intermittent fasting. And as regard to the efficacy of intermittent fasting for weight loss, again, when they have compared with different methods like the alternate day fasting or the 5:2 or the time restricted eating, they found that alternate day fasting has the one which has the highest weight loss which was seen, and the time restricted eating has is comparatively slightly lesser weight loss. But yeah, you over a period of time, if you are able to sustain it and maintain it, then definitely the benefits could be seen. And also this intermittent fasting along with slightly reduced caloric intake, which would be easier to follow, will definitely help in the longer run of reducing weight.
Thank you, Dr. Samsundan. Dr. Radhika, can you hear me?
Yes, I can.
So I was asking a question, ma'am. What would be your correct advice for weight loss? And there's a lot of people advocating for keto diets or some. Yeah. So what would be the correct diet advice for people in obesity?
So in the simplest of terms, the correct dietary advice would be eating the right things in the right quantity at the right time. So we need to understand that we should be having a calorie deficit. A diet should have a calorie deficit because it is the excess energy which leads to weight gain. The excess energy is stored as fat, and this leads to weight gain. This excess energy need not necessarily depend upon the amount of food consumed. It also depends upon the composition of food. So therefore, to have weight loss, we have to have a calorie deficit. And as Jabbar sir had earlier mentioned, exercise is one of the parameters to promote a calorie burnout. But at the same time, a diet which has a calorie deficit is important. And at least a 500 kilocalorie deficit per day is required over a long time to achieve weight loss. Now, as far as the quantity of food is there, so you can have a calorie deficit and you can reduce the intake of food, but it should then at the same time be composed of foodstuffs like fibers, which are producing less of calories, and food that are rich in fibers like vegetables, especially the green leafy vegetables, the fruits, nuts, whole grains. These should be consumed in more quantity as compared to foods that are rich in fat or carbohydrates. Fats, they produce more of kilocalories. Per gram of fat produces 9 kilocalories, whereas 1 gram of carbohydrate or protein produces around 4 kilocalories. So therefore, the composition of food is equally important as far as the quantity is concerned. So food which are rich in fibers and fruits, they also contain more of water content. The fiber content helps in fullness. It makes you less hungry over time. Also, at the same time, the calorie density of the food, like food which are processed foods like, for example, anything that is made of refined flour or maida, the sweets, the white bread, candies, cakes, pastries, chocolates, cold drinks, fruit juices. The intake of all these should be minimized, or rather should be nil. Then there are so many diets that are available: crash diets, keto diets, then low fat diet, very low calorie diets. All these diets in the short term, they may cause some weight loss, but we have to understand that in obesity, just losing weight is not important. Maintaining the weight loss is equally important. It is found that more than 70-80% of the people, they regain the lost weight over 1 year. So all these diets, they may help promote some weight loss in the short term, but in the long term, they do not help maintain that weight loss. Therefore, the best advice, there is no such one size fits all approach. There is no one particular diet. The best is to have small, frequent meals, because if you eat too much at one point of time, the excess of energy that is absorbed from that diet, then also it gets stored as fat. Therefore, one meal should not be very heavy. It should be small, frequent meals, and eating in the right quantities at the right timings is important. Timings is also equally important, because if you eat too late, or if you don't eat at the proper timings, it affects your metabolism. So I would just like to, in a nutshell, say right things in the right quantity at the right time should be consumed.
Thank you, ma'am. I think what we should be saying, like ma'am said, is that sustainability should be the goal. Short-term diets like keto diets or very low-calorie diets are easy to do over 2 to 3 months, but it's not sustainable. So I think we should be telling our patients, or the patients should understand that whatever they're able to do for the rest of their lives, that should be followed from day one, because that will help them lose weight and also maintain that weight. And going on some fat diet for 3 months is not going to help in any way in the long term. So Jabbar sir, we spoke about bariatric surgery. Many people consider bariatric surgery as the easy way out, and it's only for cheaters and people who are not able to do a healthy diet or exercise regimen, and it's just seen as an easy way out. So what is your take on this?
Now, if I'm asking a question to you, is it a myth or not? Okay, really a myth. I'll tell you. Okay, no doubt about that. So now, see, all the treatment modalities, maybe khana, exercise, dawai, all those things has got its own limitation. I do accept. Bariatric surgery, and another name you can call it as metabolic surgery, something like that. Okay, good. I'm not against. And few things you should know. That is not the final answer for your obesity. Please remember. First thing is, if you want to get surgery done for your overweight, you should get the clearance from your colleague, your friend, endocrinologist or physician. Very, very important. I want to emphasize this point. Okay. I have seen there are a lot of surgeons, they are admitting the patient and they're doing surgery. It's not correct. Always, my friends, go to your physician and get clearance. That's number one. Bariatric surgery has got its own problems also. Basically, it's a surgery. Carries the problems of a surgery. Of course, everybody knows that. Any patient going for surgery, including circumcision, they knows that there are problems. I do accept. But bariatric surgery is not a joke. So, first thing is you study what's happening and is really indicated. If no other methods, you have tried your foods, you have tried your exercise, and you have tried the newer molecules. So there are good molecules, newer molecules are in the pipeline. We did a study also with one new medicine which found to be useful also, which also you should remember. After that, maafi faida, no faida. Such a situation, you can consider going for this surgery, bariatric surgery. But mind you, even after surgery, there are 1, 2, 3, 4 problems that can produce multiple issues. But certain patients should not go for this type of surgery. Like, suppose you have a psychiatric problem, mental problem, you are taking some medication, not fully controlled, and your stress element is also very high. Please think twice before going for surgery. And if you have heart problem, kidney problem, all other problems also, please think before you go for surgery and discuss with your surgeon and physician. After surgery, yes, we have seen good improvement also. 100% at least I have seen few cases, good number of cases where that surgery showed good improvement. But mind you, my dear friends, even after surgery, you should get frequent checkup because you are removing a part of your stomach or gastrointestinal system or your the digestive system. Okay, digestive system, you are removing a part and you are doing some sort of bypassing business. So you are a person or patient likely to develop nutritional problems. Okay, whatever you take, probably that will not get absorbed into your system. So you are likely to develop malnutrition means the deficiency of the footsteps. That's possible. For that, you should do your investigations also at appropriate time. Number two, there are other complications also. There are small bone problems, sugar problems. All these complications are likely to develop in your future. So that's the reason I'm telling you. First thing is your behavior change, your modification of diet, your exercise. If no faida, no benefit, such a situation, you can consider all those things and fully anticipating the issues or forthcoming issues after surgery also. But another small comment I want to make, there are very fancy treatment. Once upon a time, I still remember in the 2003, 2004, surgery for diabetes mellitus. Apparently a good idea, super idea, but so all this surgery has got its own limitations also. But I should admit this surgery has got some benefit also, especially in terms of diabetes medication reduction is useful. There is no doubt about that. But by and large, you should be little more careful before opting for surgery for obesity. That's a take-home message. If no other method, you can consider, and prevention is also very important. Obesity prevention. For that also, you should change your behavior, food, and exercise. Over to Dr. Lakshmi for continuing the process. Yeah.
Thank you, sir. Dr. Shamsundar, my next question is to you. Many people think that obesity is only a problem of the adults, and people, children who are on the overweight side tend to be more healthier. In fact, mothers often worry if their children are, of normal weight or even a little bit on the lower weight, that children are not healthy. So, what's your take on this?
Yeah, true. This is often it's the mother's concern. And in fact, even my mother, when she used to take me to the pediatrician, she always used to say, "Sir, do something so that he goes this way." So, and yes, it's definitely not it is not normal to be obese in children. So it is abnormal, and we have seen studies which have shown that recently the prevalence of obesity in children also it is increasing to the tune of around 15 to 20% of the children in the urban areas are found to be obese, and this obesity in children is associated with many problems. Like we know they can have excessive snoring, asthma, and coming to the endocrine problems, the children as in the early adolescence they can enter, they can have develop PCOS, and we are seeing of late even children as young as 6 to 8 years or 10 years developing type 2 diabetes, which is the diabetes which is associated with insulin resistance. So all these features, and also obviously we have to consider that it can lead to body image disorders also in the children. So definitely children being obese is not normal and is not good. So it is a first step. We have to educate the parents and we have to reassure them it is normal for a child to be lean, and as long as the child is growing normally and he's having the normal scholastic performance and he's functioning well, then it's we should discourage the mothers from overfeeding them. It is always we see the mothers running behind the children like, no, you finish this, you finish this. So from there only our the trend of overfeeding is getting started. Maybe if we address this and if we counsel the mothers, we can reduce that. And definitely the obesity in children is not normal. It could be because of various other reasons also, apart from the diet, exercise, like sir mentioned. It could be because of some syndromic causes also. It needs evaluation. If your a child is obese, when your pediatrician would have provided you this growth monitoring chart, and if you find that your child is above this 85th centile or above the 95th centile, please do consult your doctor and get them evaluated for that. Thank you.
So speaking of childhood obesity, my next question is to you, Dr. Sakib. Many people believe that not breastfeeding for a full 2 years or even 3 years can lead to obesity in children, and this is in fact the only main reason for obesity in children. So, what is your take on this?
So, yes, actually, our fate starts from the intrauterine life. Now, it has been established that overnutrition as well as undernutrition, they both are malnutrition, and they both are risk factor for future risk of cardiovascular disease and obesity. So, and when a mother breastfeed her child, actually the chances of losing the excess weight which she has gained is good, as well as the risk of obesity as well as overweight has been shown to be reduced in the child who has been breastfed, and it also has a linear relationship. The number of months the child has been breastfed uh, is proportional to the lesser risk of having obesity or overweight in the future. So it is an established risk factor. We must not deprive any child of breastfeeding as far as possible, and there are hardly any contraindication of breastfeeding. We must ensure it in our practice and around our practice area. It would be good for mother's health as well as for children health. It would be associated with lesser risk of obesity as well as the cardiovascular disease risk factor because of it.
Thank you, Dr. Sakib. So, my last question is to you, Dr. Radhika. What is the role of vitamin supplements or any natural remedies in weight loss?
Okay. So commonly we see advertisements and promotions related to the herbal supplements or vitamin supplements claiming to cause weight loss. But actually, we really don't know what are the constituents of these herbal supplements. At times, they may act by reducing your hunger, increasing your satiety, or modulating the hormones that control the appetite. But there is not enough evidence to show that these supplements or vitamins or herbal supplements, they actually promote weight loss, and therefore they are not approved by any of the obesity management guidelines. Also, when you see carefully, there is always a star attached to it that consumption of any of these supplements should be associated with a proper diet. You need to take care of your diet and exercise well so as to cause weight loss. So in very few people, if these herbal supplements in the short term do cause some weight loss, it is probably due to the diet and exercise that needs to be followed along with this. So therefore, these are not approved, and diet and exercise remains the mainstay. Thank you, Dr.
Thank you,
Lakshmi.
ma'am. Thank you, ma'am. So before we wind up, we have a few questions from the audience. Some of it we have covered. So I'll just take up the questions that we have not covered. Jabbar sir, this question is to you. So does lack of sleep lead to obesity?
Okay, it's a good question. It's a good question, in fact. Okay, certain normal activities should be there in human life. One is sleep. Even oversleep, definitely that will lead on to increase in weight. Even the sleep deprivation is also reduced sleep. It's also a risk factor for all these problems. So what I would suggest, or book says, or our medical field says, sufficient sleep. Say around 5 6 hours. That's good. More than 7 hours, not good. Less than 5 hours, not good. But see, sometimes if they're adapted to that, there is no issue. But excess sleep definitely is dangerous, and reduced sleep also can produce lot of problems. Not only weight increase diabetes, pressure, lot of problems can come up. Over to Lakshmi.
Thank you, sir. Radhika ma'am, this question is to you. Is obesity associated with malignancy? Can obese patients have high risk of malignancy?
Well, yes, obesity leads to increase in insulin resistance, and that can be associated with increased risk of colon cancer, even breast cancer. So obesity can lead to malignancy because of the associations with insulin resistance.
Thank you, ma'am. So next question is to Dr. Shams. Any simple method to calculate the right amount, the right weight? Mr. Srinivasa Rao was asking. Any simple method that we can use to calculate the right weight of the patient?
Yeah, the most simplest method which I often suggest or the is like your height in centimeters minus 100 should be your maximum weight or the appropriate weight. So if your height is say around 160 centimeters, so the body weight for you would be a maximum of 60 kgs, and above or that means that you are gaining excess weight. So this is a simple formula. Your height minus 100 should be your appropriate body weight.
Thank you, sir. So I think we don't have any more questions. A wonderful session. Thank you all the panelists for your wonderful insights on obesity. And some of the viewers are also saying thank you and conveying their gratitude to you. So thank you, Jabbar sir, Radhika ma'am, Dr. Saqib, and Dr. Shamsundar for joining us and busting a lot of myths on obesity. I think some of the questions that our viewers had on obesity and some of the myths that they might have had on all the obesity, especially after seeing all the ads on obesity, the herbal remedies, or maybe the easy ways to lose weight. There are so many out there on social media. I hope our viewers don't fall prey to this and follow the right method to lose weight and also sustain weight loss. Thank you, Vasanal.
So before concluding, can I just put in a few words?
Sure. Go ahead.
So before concluding, I just want to say this fight against obesity or your journey against weight loss, it's just like the hare and the tortoise race. So we all have heard about that story. So the faster you run like a hare, at some point of time you tend to get tired and you just take rest. So this fight against obesity, it's like slow and steady always wins the race. So always try to achieve the slow and sustained weight reduction which is always good, and you can always maintain that in the long run. Thank you. That should be.
And I would just like to
And
add
thank you,
to
Dr.
it,
Lakshmi.
eat right.
Yeah.
So I think eating right, exercise